in April Agumuo, ATS nursing student from the University of San Agustin. So in this video, I'll be showing you the skin preparation of the surgical site of the cesarean section. But first, let us know what is skin preparation of the surgical site of cesarean section. Skin preparation of the surgical site for cesarean section greatly reduces the number of bacteria on the skin prior to surgery and decreases the risk of infection. First, of course, let us tackle first the general considerations. First, we only have to use alcohol-based antiseptic solutions containing chlorhexidine gluconate or CHG for surgical site for skin preparation. Second, we have to ensure that the site is clean and free from any abdominal hair. Third, we have to wear our proper scrub attire. Of course, don our gown as well as the gloves before prepping the skin. As well as for the fourth, determine the type of C-section incision of the surgeon will perform prior to the procedure. Fifth, we have to apply solution using sterile gauze and instruments with movements from clean to dirty area, starting from the center of the incision site and moving outwards, maintaining an aseptic technique. Then, of course, allow to dry fully before incision. For the sixth, we have to ensure that the drapes are not saturated with alcohol or that the alcohol-based solution has not formed a pool underneath the patients before operating. And the last one, we have to ensure that any adverse events associated with the solutions used are investigated and recorded. So assume that we've already performed our hand hygiene and then assemble all the materials here on a sterile prep tray. And after your patient is anesthetized and positioned on a dorsal decubitus on the operating room table with under paddings, we're going to expose the area by holding back the sheet. Now we have to double check the operative site or the operative area as well as the procedure on the patient's chart as well as the operative permit. So here in our turn demonstration, the operative site or area of our patient is the midline vertical. Now we're going to put 2 sterile towels above and below of the operative area. This is to isolate the area and protect our glove hands while performing the prep. Of course, don't forget to don our surgical gloves using the open method and always maintain the sterility. So this is your demonstration. This Coca-Cola bottle will serve as my alternative for the chlorhexidine gluconate solution. As well as this package is my complete materials for the skin preparation. First, we're going to clean the umbilicus, and here is our stick applicator. We're going to dip it on the solution. The umbilicus should be free from any dirt, lint, or any other materials. Now we're gonna wet our sponge on the solution. And squeeze out the excess. We begin time wash or scrub usually 5 minutes. First, we're gonna start on the incision site. Now we're gonna throw this or discard this our first sponge. Now we get our second sponge. Of course, using a circular scrubbing motion and work out from the center in a spiral motion. And then we discard this. We're going to get the third sponge. And after that, we just let it dry, or we're going to dry it using 2 sterile towels. This is to prevent the skin from irritation or any skin fires. Usually you have to dry it for 3 minutes. Now we're going to get the 2 sterile towels that we put earlier. And also don't forget to don and discard the gloves.